Our next speaker is also going to talk about topics that relate to DARPA. She did a lot of research for them, and through some of her discoveries, she will actually help impact citizens' health. Please welcome out Alicia Jackson.
Thank you. In 2010, when I arrived at DARPA, we were faced with the following problem, which is that the military sends millions of its members across the globe, and in many of those places, there is no medical infrastructure. So if somebody falls ill, there's no minute clinic or physician's office or even a phlebotomist to take a blood sample. And so we were faced with the challenge of how do we diagnose this individual in a robust, accurate way, no matter where in the world they may be located. And so we invested in two technologies. One, enable that individual to collect their own blood sample, and number two, enable that sample to be shipped back to a clinical lab without having to be packed on ice. And as those technologies began to pay off, we began to realize that it could have a huge impact way beyond the military, but on personalized medicine. Today, the conversation has been completely constrained around genetic sequencing. We'll sequence your genome, we'll look at your variations, and we'll figure out what your risk profile is. But what you really want to know, or what I want to know, is am I developing that disease? Am I developing it tomorrow? Am I currently developing it? And the challenge is that genetics tells us fate. It doesn't tell us state. And that's actually the information that we want to measure and to capture. Now, the genome is largely static, and what you want is the dynamic information that's carried by the RNA and the proteins that are being not only expressed off the genome, but are being impacted by your environment, and that are actually a reflection of your real-time state of health. And this information is dynamic, it's not static. Now, you may say to me, Alicia, well, we already collect this dynamic information. We do, but we don't. Throughout the course of our lives, from birth to death, we only measure these biomarkers a handful of times. We measure them at some age-specific checkups, and then we measure them when we're ill. And we don't compare them to ourselves in our healthy state, but we only compare them to when we are a population average, which is not reflective of ourselves. What would be much more powerful is if we could track these levels dynamically, frequently over time, in periods of wellness and in periods of illness. And through this information, begin to be able to develop the ability to actually predict not only disease onset, but our treatment course and the impact of those treatments. Let me make this very specific. There is a cancer biomarker known as cancer antigen 125, and it's an ovarian cancer biomarker. And it's used as a threshold test. So if your level of CA125 is above the threshold, you're considered to have cancer. But most clinicians will tell you it's way too late. The other challenge is that even if you test below the threshold, most early cancer patients measure already below the threshold. The result being that most people who are then diagnosed with ovarian cancer are already in the latest stages when it's least curable. What's going on here? What's going on is that we're using a population average and assuming that that average threshold is the same for every single one of us. The other challenge is that all the women in this room, our levels of CA125 vary anywhere from 7 to 40% over the course of a month. And so what would be much more effective is if we could track those levels over time and understand what is normal for us. And indeed, there was a group in the UK who just published a study last year that looked at 50,000 women over the course of a decade, in which they measured their levels of CA125 as infrequently as every year and as frequently as every 12 weeks. And the result was astounding. What they found was that regardless of the initial and final magnitude of the CA125 measurement, if they saw the measurement double over the period of 6 months, they were able to diagnose 86% cases of ovarian cancer, doubling the effectiveness of the biomarker. And this isn't just the case for CA125 and ovarian cancer, but it's the case for many biomarkers that are currently correlated with things like neurodegenerative disease, other types of cancer, and oncology, and cardiovascular disease. And so what we can sense is that we're very close to a near future, where just by changing the way that we measure biomarkers that are already FDA approved. We don't have to discover anymore. We can dramatically increase their effectiveness. But it's predicated on being able to take this frequent blood sample. And as any of you know who've given a blood sample recently or gone to a blood draw center, the user experience is atrocious. What we need is a way that is as seamless to our course of care as when your doctor uses a stethoscope or a tongue depressor on you. You want something that can be implemented quickly and seamlessly, even so that you can do it in your own home. And the key insight that we had at DARPA, and that I am currently building right now, is that those same technologies that enabled us to acquire and transport a sample from a soldier anywhere in the world are the same technologies that can enable us to acquire a sample anywhere in our healthcare system and anywhere in our daily lives. Thank you.